distinguished lab professional with advanced academic training and a strong foundation in medical lab sciences. And he brings practical expertise to this subject. So with that, I'm going to invite questions at the end of the session. And maybe at this point, Agre, if you can hear me, you can just say hi and proceed. Perhaps, Agre, you can confirm that you can hear me? Okay.
Yes, I can hear you now.
All right. Very good.
All right. Here we go. Thanks very much, Fred. I really appreciate that introduction, and really appreciate also our audience who are listening and participating in this CPD learning portal. We are going to learn together, and the topic is about the adrenal function test. As the moderator has introduced the topic for today, we are going to we're going to look at the tests, the key analytes. Those are the key tests and the quality assurance in the analysis. Now, this is a very important gland, the adrenal gland, because it plays key roles in life. Without this gland, I don't think whether there will be life. The way we put emphasis on certain glands, certain organs, certain systems in the body, we also have to know that adrenal gland is one of the most vital glands in our bodies that regulates a variety of issues, a variety of physiological functions of our bodies. The adrenal glands are a pair of triangular shaped endocrine glands located on top of each kidney. So there is the right kidney and the left kidney. Each has an adrenal gland that's located there. This gland produces hormones that regulate metabolism. Now, also, these hormones can regulate the immune system, blood pressure, and body's response to stress. We are going to look at these issues, the body metabolism, immune system, blood pressure, and body's response to stress. All these are physiological functions that are regulated by the hormones that are produced by the adrenal glands. The adrenal glands yes?
Maybe if you can hear me, sorry for the interruption. Maybe you can just move closer to your device. I think a few people are saying you are a bit low. Maybe you can just move closer to your device and then let's proceed.
Okay. I hope I'm audible now.
Yeah, let's proceed.
All right. Now, as I've said that there are a variety of hormones that are produced by the adrenal gland, which regulate vital functions such as metabolism, immune system regulation, blood pressure regulation, and body's response to stress. Now, we are going to look at how this gland plays a crucial role in regulating these functions. We are going to also look at the stress response, how electrolyte balance is regulated, and body's metabolism is regulated. adrenal function can lead to significant morbidity and mortality if left undiagnosed or untreated. So you see, this is crucial information that we're going to learn from here, so that we are able to consider this adrenal function panel with the weight that matters, the weight it requires, just like the way we consider electrolytes, like potassium, the way we consider cardiac markers. Okay, although some of them are emergency tests, however, even if adrenal function tests are not emergency tests, they are very significant in control of life's processes. The overview of this presentation, we are going to look at the definition of the adrenal gland, which we've partly touched. We are going to look at the adrenal gland hypothalamic pituitary adrenal axis, HPA axis. In addition, we are going to look at adrenal gland structure and function. We are also going to look at adrenal function test and interpretation. So basically, those are the 4 elements that we are going to look at. Now, because we've touched on the definition of adrenal gland, we are going to look at its anatomy in a few slides to come, and check and see just a basic anatomy of the adrenal gland. We're going to have a glimpse of that. However, now we are going to jump into hypothalamic pituitary adrenal axis, that's HPA axis. The adrenal gland interacts with the hypothalamus and pituitary gland as the brain, and in the brain as part of the hypothalamic pituitary adrenal axis. So we are going to look at these glands and how they relate to one another, the pituitary, hypothalamus, and the adrenal glands. How they check, how they control each other, the checks and balances of this of each and every one of these 3 glands is a triad of response from each of the 3. And we are going to check to look at the way in which this triad of functions, how they regulate stress responses and other metabolic issues, and also hormonal response to immune system function, and also other issues like fight and flight response. We know that in this axis, we are going to also to consider an additional gland, which is an additional organ, which is the kidneys, because the kidneys are controlled by the adrenal cortex, because the adrenal cortex produces certain hormones that regulate the function of the kidney, like the aldosterone. The hypothalamus releases corticotropin releasing hormone, that's CRH, and this hormone signals the pituitary gland to produce ACTH. So adrenocorticotropic hormone is called ACTH in brief, and this is triggered, the production of ACTH by the pituitary gland is triggered by the corticotropin release hormone, that's the CRH. Now, as I've said, we are going to look at a triad of responses of each of these 3 glands, that's the pituitary, adrenal gland, and the hypothalamus. Because now, the role of the pituitary gland in this triad of functions is to release adrenocorticotropic hormone. And this adrenocorticotropic hormone travels the adrenal glands to stimulate them to produce cortisols. So from the pituitary gland to the adrenal gland, ACTH goes to the adrenal gland to stimulate production of cortisols. In the kidneys, the adrenal glands are located on top of each kidneys. Each kidney, left and right. The aldosterone is produced by the adrenal glands. Aldosterone is produced by specifically the part of the gland called adrenal cortex. And this hormone acts on the kidneys to regulate sodium and potassium balance, which helps control blood pressure. Sometimes it can be difficult to find out, for physicians to find out the cause of blood pressure. Unless with experience and adequate knowledge and training, adrenal gland can be also analyzed in line together with the kidney function, together with the liver panel, not liver panel, together with the lipid panel to assess the cause of hypertension. In addition to that, there are other elements that analytes that can be done to assess the cause of hypertension. Some of them, more often, even thyroid function, because thyroid hormones regulate blood pressure. It's also a key organ. Thyroid gland is a key organ that can be analyzed in addition to the adrenal gland. Now, let's look at the sympathetic nervous system. The sympathetic nervous system directly stimulates the adrenal medulla to release epinephrine and norepinephrine, which prepare the body for the fight or flight response by increasing the heart rate and sending blood to muscles. So this is a system of fight and flight response, and the organ that controls fight and flight response is the adrenal gland, a specific part that produces these hormones, that is epinephrine and norepinephrine, is the adrenal medulla. Now we've seen two parts in the anatomy of the adrenal gland, the cortex and the medulla. Now, we also look at the liver, how the liver interacts with the adrenal gland, because it stores precursors of many of the adrenal hormones and produces cortisol binding globulin, which binds to cortisol in the bloodstream. So other organs also come to play, although the major ones are the ones that I mentioned earlier. That is the hypothalamus, pituitary, and the adrenal gland that work together as in this triad of functions, but they are assisted by two other organs, the kidney and the liver. The liver now produces cortisol binding globulin, now which binds the cortisols in the bloodstream. Next, we are going to look at the adrenal gland structure and function. The key functions, some of them I've stated earlier. The key functions are to help regulate blood pressure, control metabolism and blood sugar, manage body's response to stress, influence the immune system, maintain balance of salt and water in the body, those electrolytes, plays a key role in development of sex characteristics. Now we're going to look at a closer look of the anatomy and function of the adrenal gland. Adrenal gland consists of two parts. It has the cortex, as I mentioned in the previous slides, and also the medulla. The cortex produces glucocorticoids. That's the cortisol is a glucocorticoid. And also the cortex will also produce mineralocorticoids. And here we're going to talk about aldosterone or aldosterone. And finally, the adrenal cortex will also produce androgen. These are sex hormones. That's why we are talking about regulation of sexual characteristics. The medulla produces catecholamines, and these catecholamines are two, norepinephrine and epinephrine. These are hormones that control stress and the stress that are involved in stress response, can be fight or flight. This is the basic anatomy of the adrenal gland. You can see the adrenal gland is where it's located in the kidneys. You can see those two major parts of the adrenal gland, that the adrenal cortex and also the adrenal medulla. Now, we are going to dive into deeper into the physiology of the adrenal glands. Now, we are going to look at the adrenal function tests. These tests can include cortisol levels. They also include ACTH, as adrenocorticotropic hormone, dexamethasone suppression tests, aldosterone and renin levels, and also catecholamines. These are the major analytes that are done in the laboratory to assess the adrenal functions. So in cortisols, we have morning cortisols. When you are running cortisols as a test requested has to be specified. If not specified, maybe you can inquire from the ordering physician or clinician. You can inquire, you can make an inquiry, or if you are unable to reach the physician, it's good for you to consider finding an amicable way of understanding what is being requested for. You can look at the clinical history. You can maybe try to look for information concerning the tests that have been requested, but don't just draw the sample and run the test. You have to know whether it's a morning cortisol, random cortisol, is it 24-hour urine cortisol? Look at the sample requirements for that. Look at the clinical history. You'll be able to know whether is it a morning or random cortisol, or is it AM or PM, morning or in the afternoon. Is it 24-hour also urine-free cortisol? Yes. So if the sample is urine, then you need to understand whether it's 24-hour urine free cortisol. And we'll look at each one of them and the sample requirements for analyzing running these analytes. First of all, it's very important for you to know which cortisol levels are being requested for before deciding to prepare the patient for analysis. We are also going to look at the others, ACTH, also dexamethasone suppression, aldosterone and renin levels, and catecholamine levels. How we prepare the patients, how the samples are drawn, there is sample requirements, etc., etc. In a closer look at the cortisol levels, cortisols normally changes throughout the day. cortisol are highest in the morning and lowest around midnight. So if you happen to work at night and sleep during the day, the pattern is usually reversed. So this is the control of the cortisol levels is a natural response, and it just cycles around the awakeness and sleep patterns, and also time of day. Time of day, which is time of day or time of night, what we call circadian rhythm affects cortisols. What is considered a normal cortisol range depends on the person, time of day, and the lab doing the testing. Typically, the normal cortisol ranges for an adult getting a blood test are 6 a.m. to 8 a.m. is 10 to 20 micrograms per deciliter. Around 4 p.m. is 3 to 10 micrograms per deciliter. So you can see these differences. So it's very, very key for you to understand which cortisols are analyzed and report them as so. Because there is, your results should also have the reference ranges for both, and also they should consider giving information that is needed for the results to be interpreted accordingly. So it should be indicated clearly that this sample was a morning sample, and or this sample was an afternoon sample, or this sample was 24-hour urine sample, specified according to the needs of the diagnostic need that has been presented before you. Cortisol testing is indicated in individuals with symptoms suggesting high cortisol, like now Cushing syndrome, low cortisol, Addison's disease. So when we have high cortisols, we have Cushing syndrome. Low cortisols, Addison's disease. To evaluate the adrenal gland function and monitor treatment is the third function of the third reason as to why we do cortisol testing. The key indications include unexplained weight gain, high blood pressure, and easy bruising for Cushing syndrome. While symptoms like chronic fatigue, weight loss, and low blood pressure points towards Addison's. Testing is also used to assess the pituitary gland function in producing ACTH to check the adrenal crisis. So we checked that axis, the adrenal gland, pituitary, and also the hypothalamus. Yeah, an error can be in one of those glands, not so the origin of the problem can be assessed from the three organs. That's pituitary, hypothalamus, and the adrenal gland. So to comprehensively make a diagnosis. Now let's look at the pituitary function. The adrenal and pituitary function. Adrenal insufficiency is checked to determine if adrenal glands are producing enough cortisols, which can also be a primary problem or secondary to a pituitary issue. Yes, if there is a malfunction in pituitary function, there will be a problem with production of certain hormones from especially the cortisols in the adrenal gland. But the pituitary function is done to evaluate if the pituitary gland is releasing enough ACTH to signal the adrenal glands to produce cortisols. As we looked earlier, as we checked earlier, we realized that ACTH is produced from the pituitary gland to stimulate the adrenal gland to produce cortisols. So if there is a problem with the pituitary, then the ACTH is not produced adequately to address this issue of hypocortisolism. The pituitary gland can also be used to monitor treatment of the adrenal gland, especially for cortisol-related disorders, to check the impact of corticosteroid medication. So if someone is under medication, especially corticosteroids, can be to address the issue of adrenal gland or to address the issue of other issues like glucose control, glucose metabolism, fat metabolism, and many other issues that can be related to what is being diagnosed. We can consider doing the pituitary check to assess the effectiveness of cortisol, the effectiveness of the impact of medication, the efficacy of medication or treatment. So interpretation of adrenal function tests, low cortisols are usually an indication of adrenal insufficiency. Insufficiency, it means that adrenal gland is not at par to produce enough, to function properly, optimally. High cortisols will mean that the adrenal gland is hyperactive and produces a lot of cortisols, and this leads to a condition known as Cushing syndrome. Abnormal ACTH simulation tests can also be done to check the adrenal insufficiency or Cushing syndrome. Abnormal dexamethasone suppression tests will indicate that there is Cushing syndrome. Adrenal insufficiency is a primary adrenal. Now we have primary, secondary, and tertiary adrenal insufficiency. Now, primary adrenal insufficiency will indicate Addison's disease. Secondary adrenal insufficiency will indicate pituitary or hypothalamic function. So when we are checking the pituitary function and hypothalamic function, we are looking at whether these glands are playing a role in the function of the adrenal gland, because the adrenal gland can be functioning very well, but the input from other organs that are related in specific physiological control, if those organs are abnormal, there is an abnormality or an anomaly, there will be poor response of the adrenal gland. So that's why we were talking about the triad of functions, especially relating to the pituitary gland and hypothalamic, the hypothalamus. Tertiary adrenal insufficiency will indicate that there is exogenous steroid use or exogenous introduction of a certain elements in the body. Like now we look at one example. Okay, we look at examples. Medications are among them in tertiary adrenal insufficiency. Yeah, that's why sometimes more often there are tests that have to be done to check whether the treatment is optimal, or to monitor treatment or treatment response. Sometimes these tests are ordered regularly to check the body's response to the treatment, so that the patient is kept safe or is kept under optimal treatment. There are three types of cortisol, especially in testing. We have free cortisols. We have also salivary cortisol. We have also urinary cortisols. Cortisol saliva tests sometimes can be difficult to make to do analysis, especially patients who come to an inpatient center, outpatient center, and you can't refer some of these patients. You cannot refer them to for an admission because of the test alone. But there is due to modern technology, now we have tests that are take home, especially for sample collection, so that the sample is taken at home and the sample is brought to the lab for analysis. So the patient is usually advised. You have to give clear instructions to the patient so that the sample is collected properly. The laboratory provider will give the sample collection kit. They tell the patient what time to collect the saliva test specimen and how to collect it and how to return it to the lab for testing. The kit will have specific instructions, but in general, it involves the following steps. Don't eat or brush your teeth 30 minutes before taking a test. Also, don't floss or smoke or vape during this time. There are reasons as to why we have to advise this patient not to floss, not to smoke or vape during this time. Without touching it, drop a swab in your mouth. Wait for a couple of minutes until it's soaked with spit or sputum. No, not sputum, but saliva. After a couple of minutes, spit the swab out of the test container, into the test container. Again, don't touch the swab with your fingers. So you, after inserting it in your mouth, for it to be soaked with saliva, insert it carefully without touching the swab with your fingers. The instructions for returning the sample back to the laboratory are usually given. But now you have to explain this for the patient to get it clearly, so that mistakes are not made. Because if a mistake is made in the collection of the sample, wrong diagnosis is made, because the results, the methodology is very sensitive. We're also going to look at 24-hour urine sample tests, the sample collection processes and procedures. For this type of analysis, we need to collect a 24-hour urine samples for cortisol tests. And it begins by first discarding a morning urine sample. Do we usually give the right instructions to the patient? First, urine has to be voided, not into the container, but discarded. But that time has to be indicated when the sample collection started. Voided. Then now after that, any urine that is being produced has to be put into that container for 24 hours. Now the last urine has to be 24 hours later, after that morning urine has been voided. So the collection sample begins in the morning with discarding the first morning urine sample and then collecting the rest for that 24 hours. Then at 24 hours mark, the sample is collected and delivered to the lab as soon as possible. First, record the start time. Upon waking up, empty the bladder completely into the toilet. Then take note of the time and the date. And then you start the 24-hour period. I've just repeated for emphasis. All the urine collected over the 24 hours, even a drop of urine is passed is collected, including any at night, into that special provided container. Store the sample. The sample is kept in a cool place like a refrigerator throughout the collection period. There are other exceptions to this, but I will explain. The stop time is recorded exactly 24 hours after the collection has started. First, urine is collected and added to the container. Final is urine is collected and added to the container. The end date and time is recorded on the label. Now, the container is labeled correctly to ensure that the label is clearly filled with full name, date of birth, both the start and the stop times of collection. The sample is returned to the lab, completed and tightly sealed to the lab. Ideally, should be the same day of collection. There are important considerations that we should have, like diet restrictions. We were talking about flossing teeth, vaping. We also, I will add other points here that you should understand and make these points clear for the patients. Beverages to avoid, like caffeine, coffee, tea, and other caffeinated drinks, alcohol also, and tobacco should be avoided. Other important restrictions include medications and supplements. Medications and supplements, some of them can spike your blood, the blood can trigger the body to produce more cortisols, and you receive wrong results and make wrong diagnosis. Some medications can affect cortisol levels, so it's good for medications to be discontinued unless advised otherwise by the physician, because physicians basically know what the certain drugs contain. So there is a need of advice in that. And it's good to have a conversation sometimes with the physician so that to understand and help the patient. Stress and exercise, avoid going to the gym or a strenuous exercise. If you are an athlete, avoid that until the test sample is completely procured. I've talked about avoiding tobacco. Avoid also spillage. Preservatives, be cautious about if your container contains a preservative, as it can be harmful if it splashes on the skin. If the patient doesn't have a refrigerator, it's good to consider providing preservatives. Preservatives are key, and it's advisable to use them, especially if the patient cannot assure you of the cold chain of the urine sample. Catecholamines are tested by measuring levels of the hormones, the catecholamines, on patient's blood or on a 24-hour urine sample. These tests diagnose conditions like pheochromocytoma or neuroblastoma by identifying excess hormone production, which can be caused by tumors. So pheochromocytomas and neuroblastomas are tumors, common tumors that are found in the adrenal gland. Evaluation of these tumors. In evaluation of these tumors, we have to do catecholamines. And in these catecholamines, we have to do a 24-hour urine test. So there's 24-hour urine cortisol test, 24-hour urine sample for catecholamines. I've given clearly, I've narrated how the sample should be collected for 24 hours. And we have these catecholamines that are usually analyzed that include epinephrine, that is adrenaline. Also, we have norepinephrine, which is noradrenaline. We also have dopamine. Pheochromocytomas are tumors that produce catecholamines. The symptoms include hypertension, palpitation, and sweating. Diagnosis is done by by identifying elevated catecholamines levels and also imaging studies on the adrenal gland. Adrenal gland with pheochromocytoma description, the patient with clinical symptoms of hypertension, the image shows adjacent normal adrenal gland with paraganglioma. Pheochromocytoma involving adrenal medulla. Now, we have preservation methods for 24-hour urine specimen for cortisols. These are the preservatives, the preservative that is being used, and also the second mode of preservation is use of refrigeration. Now, for preservatives, boric acid is preferred by many laboratories because it helps to prevent bacterial growth and decomposition of cortisols. So two roles, bacterial growth and decomposition of cortisols. Usually 10 grams is weighed and put into the container and given to the patient. So with that, there's no need of you seeking assurance of cold chain. But if you are assured of cold chain in instructions that they are followed correctly, give proper instructions and give the container without preservatives. So adrenocorticotropic hormone sample requirements. ACTH requires blood sample should be collected in a lavender top, EDTA. You should be aware that when morning sample should be collected between 7 and 10 a.m. and plasma should be processed immediately to prevent degradation. So these are priority sample. So we have a tube should be pre-chilled, plastic or siliconized glass lavender top, EDTA tube. Timing, collect the sample, blood sample between 10 a.m. and 7 a.m. and 10 a.m. Should cool immediately. Place the collection tube in ice bath after the sample is drawn. Processing within 1 hour of centrifuge the sample at a refrigerated temperature to separate plasma from cells. So these are priority specimens and should be considered as so because of the quality of sample. And these are key requirements in analysis. So freezing, you should transfer the plasma to a separate labeled plastic tube and freeze it immediately until it can be tested. So this is when there is a delay, you have to freeze it. Stability, frozen sample is stable for 14 days. Be aware of that so that the correct diagnosis is gotten. We have another test that's quite important. That's dexamethasone suppression test. Dexamethasone is a synthetic steroid that mimics cortisol's role in regulating hormone production. Negative feedback usually taking is negative feedback is usually checked by taking dexamethasone, because dexamethasone sends a signal to the pituitary gland to stop producing ACTH. So dexamethasone plays a key role in stopping ACTH hormone from being secreted by the pituitary gland, which in turn tells the adrenal gland to stop producing cortisol. So one affects the other through negative feedback. So when this sample is taken and there's lack of suppression, when this drug is taken and there's lack of suppression, you will be able to point to a diagnosis of Cushing syndrome. This is a negative feedback loop is disrupted, especially in Cushing syndrome. The cortisol levels are not suppressed as they should be. Types of dexamethasone suppression tests, we have low dose and high dose. Low dose it's usually used in initial screening or confirming tests for Cushing syndrome. Overnight test is done. A single 1 milligram dose is given, and the blood is drawn the next morning to check whether the cortisols were suppressed. There is also one standard 3-day test, whereby we give a low dose of 0.5 milligrams of dexamethasone, which is taken 6 hours for 2 days. And urine cortisol is measured after 3 days. So there are two low dose overnight tests and also low dose standard 3-day tests. So each has its own dosage, and this dosage should work together with the physician to give clear instructions on when the drug should be taken and when the sample should be taken. On high dose, use after Cushing syndrome diagnosis to help differentiate between the causes such as pituitary tumor, that's Cushing syndrome, or an ectopic ACTH producing tumor. This test helps determine if the adrenal gland is responding to signal to stop producing cortisol. There is overnight high dose. Take 8 milligrams of dexamethasone at 11 p.m. and have your blood drawn at 8 a.m. the next morning. Standard high dose, the higher dose is given 2 milligrams. It's taken every 6 hours for 2 days, and urine cortisol is collected over 3 days. 2 mg, you'll see 2 mg is a lower dose, but it's taken every 6 hours. Every 6 hours for 2 days. So basically, when you accumulate that, it will surge in the body and it becomes a high dose. So this is why it's called standard high dose test. Urine cortisol is collected over 3 days. There is also IV tests used for patients who have trouble with oral medication for compliance or absorption. There's another hormone that I was talking about that now we are going to see how it also regulates kidney function. That's renin and aldosterone. Renin is an enzyme produced by the kidneys in response to low blood pressure. It triggers the production of angiotensin, which stimulates the adrenal gland. Aldosterone is a hormone produced by adrenal glands. It acts on the kidneys to increase sodium and water retention, which raises blood volume and blood pressure. Aldosterone and renin sample requirements. Patient's positioning. Collect after the patient has been sitting or standing or walking for at least 2 hours and has been seated for 5 to 15 minutes. So consider that postural physiology has to be considered here. Tube types include lavender, and you've seen cortisols. We have to consider plasma, which is EDTA. That's EDTA, and also we can consider plus the red top. That's ST, especially for serum. Avoid chilling. Do not place the tubes on ice in a refrigerated centrifuge at any point during collection or transport. So consider also this when we talk about the adrenal gland, it's not all tubes that should be, or samples that should be chilled. Consider which tests you are dealing with. So we should separate sample from plasma. Should separate plasma, from blood cells as soon as possible and transfer it to transport tube. That's why we are talking of if it's serum, should be serum separated tube for it to be able to separate the two components. Speed is critical. It's another priority test, but should be done within 4 hours of collection. Patient preparation. So sodium intake, maintain an unrestricted diet with normal sodium intake before the test. Medication, consult the physician regarding any medication that may interfere with the test result, especially those related to fluid balance or potassium. So here also communication is key between us and physicians and also or other clinicians. Other substances should be considered also. I talked about caffeine, talked about tea intake, I talked about smoking, vaping, smoking cigarettes or vaping, etc. There's also natural licorice should be avoided. This is a substance that's usually the chefs know about this. This is a food ingredient that's usually consumed. Should be avoided. Natural licorice. Key effects of caffeine on cortisols. When I was talking about caffeine and substances that are related to caffeine, is that caffeine will has a stimulus response. Caffeine blocks adenosine, signaling the body to release adrenaline and cortisol, stimulating a fight or flight response. Morning timing, cortisol is naturally highest upon waking up around 8:30 a.m. Consuming coffee immediately may cause unnecessary excessive spike in cortisol. So habituation or tolerance is usually found in drinkers who do it who take coffee regularly, and when they take coffee regularly in regular doses, the spike is reduced. It's not like infrequent users. So you might not know who and how much someone takes, especially in coffee and related substances. So avoid, just advise them to avoid coffee, tea, and also tobacco, vape, etc. should be avoided. Alcohol intake should be avoided. Because we are also told that the duration of caffeine-induced cortisol elevation can last for 6 hours. So it's very important for you to advise correctly. So in conclusion of this of this CME, that is good to consider the adrenal function test, because adrenal function assessment is very crucial for diagnosis and managing various endocrine disorders. A comprehensive approach, including clinical evaluation and laboratory testing, is necessary to make sure that there is accurate diagnosis and also treatment. So with that, we have come to the end of this presentation. Maybe I'll invite Mr. Fred, if you are there, for
Thank you, Agri.
conclusion.
Thank you. I think this has been a very comprehensive session, and maybe we can clap for Agri. We can send those reactions and maybe clap for him. It's been a very, very well executed presentation. And thank you, Agri, also for doing this very insightful webinar. And Asad said that we are here to capacity build ourselves. And I'm sure these tests are very important and crucial, as has been just shown in the presentation. And at this point, I'm just going to allow questions and comments, or anyone who has an addition to what has been presented. Then maybe we can discuss. But I would want to know what you do where you are, and maybe your experience with some of these tests. So I think I'll pick the first one from Mohammed Hassan. And Mohammed Hassan is asking, after first morning urine is discarded, you immediately start your timer for sample collection, or our 24 hours start from the time first urine sample is voided into the container? Agri, if you had the question.
Thanks very much for that question. More often, that's a good question. It's good to consider doing things correctly. Maybe many people make mistakes. They think that the time of collection is when you start now collecting that sample in that container. No, that's not the time it begins. It's good to know that if you leave it as a blank check, also that someone can anytime can begin and record the timing, it's also not correct. So instructions should be very clear and precise that the first sample has to be discarded. And that is when that first sample, and should be a morning sample, when it's discarded, indicate that time when it's discarded. And then now you've started sample collection. It means that you've started the process of sample collection. Because later on, any urine that now will come after that discarding of that sample will have to be put into that container for the next 24 hours. Yes, so I say yes, that is the time when that sample is discarded. That's the time that is recorded as the starting time. Thank you for that.
Thank you. I think we have another question from Anita Ngina. Why discard the first sample?
Why discard the first sample? We discard the first sample. You see, according to the circadian rhythm, now the first we were talking about the morning spike in cortisol levels because of circadian rhythm, and that cortisols are highest in the morning, and they are considerably low in the afternoon and lowest at night. Now, when you discard the first urine sample in the morning, it means that the cortisol levels that have been there, the cortisols in urine that have been there, especially in the time of the night, will now bring a confusion in getting the average cortisol levels for the next 24 hours. So it means that the previous night, in simple terms, the previous night is not considered in analysis. Now we are beginning the analysis in the morning. If that urine sample is collected the morning, the first sample is collected in the morning, it means that we are moving 12 hours back or some hours back in the night, the previous night, which is not ideally the time to consider, because now that will be over 24 hours. 24 hours begin when the sample is discarded, and we begin a fresh chapter of now collecting the sample that's supposed to be analyzed. I don't know whether I've explained it clearly, but that is how it should be, that the sample that should be analyzed is collected after the urine from the previous hours have been discarded, especially in the morning, in the previous night, into the morning.
Thank you, Agree. I think that has been explained well. And then Jacqueline is asking, is there a difference between serum and plasma catecholamines? Agree. And then I think we have really had the input from many of you. I think many are feeling the session was packed. I think that has been noted. Thank you. Yes, Agree.
Thank you. Thank you. There is no major difference between the plasma and the serum. However, the difference will come especially in processing the sample. If the sample is not processed correctly, there will be a difference, and this difference is caused by errors in sample preparation. You see, when you collect EDTA plasma and you don't separate it as required, some samples require pre-chilled container tube. Some of them don't require pre-chilled tube. SST, if you don't, like now EDTA, if you don't spin the sample as soon as possible, you see the mixture of the cells and the plasma itself will bring about errors, especially in cortisol levels. So immediate centrifugation is very necessary. And again, when you separate it under SST, make sure that also time is very crucial, especially in analysis, even if you've centrifuged and separated. Centrifugation is very key, and also separating the cells from plasma. That's where the difference will come. If you don't separate, you put it in a different tube, then there will be big disparities on these samples. You might analyze plasma of the same patient and also serum of the same patient, and you get big disparities. Why? It's because of the processing. If both are processed correctly, there will be no differences. There will be no unacceptable differences between the two samples. Thank you.
Thank you, Agree. I think there's a question here from, all right. I think there's a question from Julius Inzira. He is asking, can one use concentrated HCl for 24-hour urine collection? Thank you, Julius, for the question.
Yes, concentrated HCl is also used as a preservative. And you should also check the molarity of that HCl and also the volume. Kindly check which molar concentration you are using and also the volume. It's used. Yes, it's used.
Thank you. I can see another question from Dr. Gatua. Dr. Gatua is asking, kindly explain the methodologies for testing catecholamines, especially in our local setting.
The methodology of testing catecholamines in our local settings. Now, okay, I've not gotten that clearly. Is it methodologies such as like now? It's not an immunoassay. We have the common methodologies that are being used for. Okay, catecholamines. There are certain methodologies that are used. Is
Yeah, maybe what we do agree. I'm sure Dr. Wilfred has something to say. I'm sure he's also an expert, especially around this area. So, Dr. Gatua, I don't know whether you're in a position to just unmute and maybe also comment on this test, as you maybe put your question in a way that maybe Agri can also understand. Wilfred, Dr.
Yes,
if you are able
thank
to
you.
unmute. Okay.
Sure. I hope you can hear me, Fred.
Sure.
Thank you very much, Agre. That was a wonderful presentation. We are learning a lot. Thank you so much. What I was asking, because we usually have this challenge of doing the test. You usually get the test. Remember, this is also a very rare test. So I remember we used to do this test at KNH. And it was a very, very manual method where you used to use some chemicals and then you look for certain color, then you report positive or negative depending on the intensity of the color. Of course, I know, like us, we are sending samples to private laboratory, which usually ship them to a laboratory in South Africa. And I'm told that they use chromatography. So I wanted to know whether there is any other method that can be used for the same test, because it's usually very expensive, very, very expensive. So I was just asking, which other methodology do we have for testing catecholamines apart from chromatography? Thank you.
Thank you. As maybe Agri comes, I can also see my senior here, Leonard. And Leonard, I'm sure you have something to say also. Maybe you can just unmute and maybe bring your thoughts.
Hello,
Leonard,
are you getting?
Yes, we can hear you.
Yeah, so what I was trying to input is that catecholamines describe a certain number of tests, which of course are determined by the adrenal glands. So the first thing you do is you ask yourself, what are the catecholamines? And I think the presenter had mentioned them at the beginning, the likes of epinephrine, etc. So you must go for the specific test. Then you look at that test, how can it be done? Is it possible to do under the current equipment that we have? Is it one that involves manual methods? Well, what Dr. Gatu has referred to is what is common, that people have been using manual methods where you go to mix those colors. And if you are a busy laboratory, chances are very high, you are not likely to use that kind of testing. So it is easy to refer because of even economic value if you are to set it up that you want to do it in your particular laboratory. So I think that's what Mr. Marube should go back and look at, that what are the tests, what are the parameters which form catecholamines. Then you go for each. How are we likely to do it? But as now, you do not have such direct methods that you can use for doing them in our available analyzers. Thank you. I hope you got me, Fred.
Hello. Hello. Thank you, Mr. Leonard, for that input. Yes, I remember the manual method has been used locally for quite some time. I've even done it before. The manual methods, I've done manual methods before. However, it's good to understand that why we should refer is that the methodology that are being used, especially the chromatography, is very, it's quite sensitive and also able to, it's used as a reference method. But when we use the color comparison and also mixing those acids, those ingredients in tubes, and we check for color comparison, it's okay. It becomes very difficult to be able to clearly, especially for those who are challenged in color detection and such like, to be able to clearly report. And also, it's a qualitative. The common methodologies that we've been using is usually qualitative. It's either making a diagnosis or ruling out, a laboratory diagnosis or ruling out. But we should be embracing quantitative methods like color chromatography. That one helps for us to clearly understand how what levels of epinephrine, what levels of norepinephrines are available. Immunoassays also are available, especially in hormonal testing, because these are also hormones. They can use also immunoassays, which are also quite expensive. Sometimes it takes considerable long time for us to be able to send the results, refer the results, the samples, and get the results back. But it's crucial for us to have the tests locally. I wish we had them being done locally. Sometimes in referring these samples, it also goes with the availability of enough tests that can sustain continuously being able to analyze these samples when they have been requested. So if you've ordered for a reagent and it takes, you do 2 tests in a month, the reagent expires, you cannot be able to sustain that that test locally. So they have to be pooled. So there has to be proper logistical planning for us to do certain tests locally, not just being able to do them and maybe asking patients to pay considerably high high costs to cover the tests. Because if, for example, if a reagent has 16 tests, okay, 15 tests, let's say, and it expires in 3 months, you do 3 tests in those 3 months. Are you able to sustain that? So it's also economics that come into play. If we had a lab locally that is able to do certain tests, such as chromatography and immunoassay, for epinephrine and norepinephrine, those catecholamines. Then that lab can welcome, can be able to come and market its services so that at least samples can be referred throughout the country or throughout East Africa for those samples to be pulled, to be analyzed around. So maybe that's what I can say on that. I don't know whether there is any other question. Back to you, Fred.
Thank you. Thank you. I think it's been a wonderful discussion. Maybe there's one more question. Let me see. All right. Maybe back to you for your closing remarks.
Okay, thank you, Mr. Fred, and also LMSK. So my closing remarks is that also adrenal function tests are very important. Maybe there are tests that we don't do locally, and maybe there are some labs that do them, but they have not come out clearly. Let them come out clearly so that we can refer the catecholamines to them. So that, because some tests are only possible through pooled the pooling factor. You are able to pool samples from all over the country so that they are a number you are able to sustain the testing because of the logistics of expiry of reagents and the costs of running the samples. So adrenal function is very important because of the parameters that are involved there in regulation of very important physiological issues of the body that pertains to life, control of blood pressure, control of glucose metabolism and other metabolic processes, controlling of kidney issues, controlling of fight and flight response, controlling assessment of pituitary hypothalamic issues, and also monitoring treatment. So it's a very important organ to consider. What could it mean when, maybe a question, what could it mean when maybe we have adrenal gland because of those tumors? The adrenal gland is removed. It cannot be treated anymore because those tumors maybe they are at risk of undergoing metastasis. What can be done? That maybe that gland is removed. Will the patient live? Is it pro-life for adrenal glands to be removed because of the very, very, very important physiological functions they play? What I can say in this matter is that when the gland is removed, the life is maintained using treatment, and this treatment is what we should monitor as a lab. The drugs that have been taken to make sure that the pituitary gland produces enough chemicals that it should produce. The cortisol, the cortisols are taken adequately, especially in terms of medications and others, and other chemical components that are required in the physiology that adrenal gland should address, such as kidney functions. Remember, we talked about renin and angiotensin processes in the body. They are regulated by the adrenal glands. But when these organs have been taken out, the other considerations that should be made for treatment so that other organs are able to bring the physiological functions that was meant for the adrenal glands. So for my conclusive remarks, after appreciating each and everyone, is that because this topic talks about stress and stress response in many ways because of the adrenal function, someone called Dada JP Vaswani said, a good way to overcome stress is to help others out, out of theirs. So basically, if you want to overcome stress, help others to overcome stress. Thank you.
Thank you very much, Agri, for the wonderful presentation. And also thank you to all participants who found time to join in to today's webinar. I'm sure it's been quite insightful. And I'm hoping that it will improve our practice from wherever we are. And maybe at this point, we have come to the tail end of today's webinar. And thank you for all your remarks and for all the participants who are able to even comment and even to participate. So once again, I think this session will attract 3 CPD points that will be uploaded directly to your portal. Just ensure that you have the correct email address, ID number, and also your KMLTB registration number. Otherwise, thank you, and until next time, have an enjoyable evening. Thank you.